warm welcome to another episode, rather special episode of the Monday Morning Learning Podcast. And this is another episode dedicated to the International Day Against Drug Abuse and Illicit Trafficking, which UN has assigned on the 26th June every year. Warm welcome to Dr. Srilakshmi Pingali, ma'am, and very honored to have you on my podcast today. Any welcome words before we start off with the themes and your introduction?
Oh, I thank you for inviting me because I think drug addiction is so rampant that it's very necessary to have such awareness programs. So congratulations to you too for actually having me on this podcast and reaching out to a larger audience.
Great. Thank you, ma'am. So we're looking at four themes, ma'am, for today as part of the International Day. We'll start with understanding the problem. We'll look at brain and behavior, prevention strategies, and support systems. These are the four themes that we'll look at in this podcast. And for the audience, Dr. Srilakshmi Pingali is a psychiatrist. She has done her MD Psychiatry at the Lady Hardinge Medical College, Delhi. She's a professor, Government Medical College, Sangareddy, Telangana. She's previously worked in IMH Hyderabad and Gandhi Medical College, Hyderabad. She's a senior psychiatrist for Roshni Counselling Center and Roshni Child Guidance Clinic, and has been the president, Hyderabad Psychiatry Society back in 2020-21. There are a lot more honors of her, but I think we'll just take these for now. So Dr. Srilakshmi Pingali, the first question to you is, what's the current state of the drug abuse and illicit trafficking globally and also in our region in Telangana and India?
Okay, so globally it is rampant and as it is in our country, and Telangana specifically, since toddy is a very kind of a culturally held drink right from childhood and celebrations, alcohol is a very big issue in Telangana state per se. Now, if you look at global trends, you see that there is a increasing use of all kinds of drugs, including alcohol and other substances. In India also, when they did a survey in about 2019, they found that if you look at a person who's used alcohol in the last 1 year, that is current, which is defined as current alcohol use, it came to around 14%. And if you look at the 1.6 billion population, 14% is a huge number. Similarly, if you look at those who qualify for a disorder, now remember, this is a survey sample done in about 5 lakh people, so and extrapolating to the population. So when they looked at drug users who are actually becoming dependent, or as we call addicted, this came to a good 5%, and also quite common in women, though significantly less than men. They also found that the use of cannabis was about 2.8%. They found that other drugs, opioids, are about 2.1%. And of course, the prevalence of each drug use dependent upon the region of the country in which they were seeing, and also the particular availability of the drug. For example, if you go to the north and of India, opioids are far more common. So when we sit in a OPDs, we get a lot of these opioid cases dependents coming to us. But when you sit in OPD in Telangana, you will find that the number of alcoholics, especially the contaminated, adulterated toddy users, are far more in the population referred.
Right. Okay. So can you discuss the social, economic, and health impacts of drug abuse and trafficking on communities, especially?
Yeah. So what we perceive as drug abuse in one particular person, and we say that, okay, his life is getting spoiled. We know that and we see that. But what we fail to recognize is the larger impact of the people using substances. So not only is he using up his own health resources to use, he's cutting down day by day. He's also using the family's resources to feed his addiction. This way, it pushes the family into poverty. Now, you imagine a low socioeconomic status person coming from, or say, a farmer from rural Telangana, who, as I'm talking Telangana because I work in a district headquarters medical college, and therefore we get all the surrounding villages referred to us. So here you have a person who is drinking and using excessive of the substance. So he's not only using up his income, he sometimes insists that his wife also give him whatever she earns. Not only that, whenever his health deteriorates, they have to rush him to the hospital. So the cost of coming from the place of residence to a hospital, spending, even though it's a government hospital, the government is not compensating, right? Yes. So that expense is theirs. So he loses his occupation. He so uses the family resources. His health comes down and future prospects come down. And if you look at the larger community, not only would it later possibilities of indulging in criminal activities to obtain the drug, or as a productive member of society also, he's coming down. So the value added to the society as a human being is also coming down, and he becomes a drain on health resources who need to support him. So altogether, there's a huge financial, legal, and emotional burden also on the family and as a community as large.
Right, absolutely. I mean, any examples you can quote specifically for even the IT sector? I mean, you quote an example of people coming over from villages. From professionals as such, have you seen such cases as well?
So many, because drug use, does not choose people. It is dependent on lots of factors. I'm sure we'll discuss that as we go along.
Sure.
So it is also prevalent there. And in the IT sectors, now the little difference is the stigma associated with perhaps majority mental illnesses, even drug use, is slightly lesser if you come to the rural. This is my experience. I'm not quoting research. So it's slightly lesser. They're more forthcoming to use the government resources and come and take treatment. Whereas in the ITs, it's a more hidden thing. People don't want, especially the middle class, they don't want to reveal that this is such a big problem. People are married off without addressing this issue. Thereby, the girls or the boys' life also gets caught in the thing. So alcohol does not choose who it will come to. It is dependent on a lot of other factors.
Right.
In IT sector, what we have found is they start absenteeism in work, not being able to cope up with the work schedule, irregularities, and finally losing the jobs, and then the financial difficulties start, and the burden keeps adding on. So whether it be the IT sector or whether it be the rural background, the impact is the same both on the person and the family.
Great, thank you so much. So coming to the theme on brain and behavior, we're looking at the neurological impact. How does substance use affect the brain, both in the short term and the long term?
So let's go back a little. And when we look at substance abuse, we have always, in the initial days, we treated it as something that is deliberate. He's doing it, and therefore he's, responsible for whatever is happening to him. Now, over the years, we have studied the brain and understood that it is not the person, but the brain that is doing it. Of course, there's some amount of voluntary control also over here initially.
Yeah.
So what happens is the initial need to use it in form of an impulse, peer pressure, availability, to fit in, to look cool, and it's there. And then when it starts here, the networks are still at an impulsive phase. You have to understand all drugs finally affect what is called as a reward pathway in the brain. Right. Reward pathway is something which releases a feel-good chemical called dopamine. Now, when you have good food, sexual activity, or a very lovely music, anything that gives you pleasure, also activates the same reward pathway. Now, but when it is a drug of abuse, it is so overwhelming that it floods the reward pathway. Yeah. And when it floods it, it takes over the reward pathway. Right. So this is the initial change that takes place, that there's an excess release of dopamine in the reward pathway. With time, what happens is, now the brain is overloaded. It has to reset itself. So it will either stop releasing it, or it will desensitize the receptors on which this chemical goes and acts. Okay. Right. As a result, what happens is the smaller pleasures in life, which will activate a smaller amount of dopamine, no longer work because the network is sort of desensitized. So it only needs a high kick to act. So these simple pleasures in life, like reading a book, listening to music, eating good food, sexual activity, no longer are as pleasurable. So this person now starts searching more and more for highs in his life. So that is more and more increase of alcohol or any substance use, which causes a dopamine kick, so to speak. So there's a negative now. There's emotions which are now becoming increasingly negative. There is a search for more and more amount of the drug, which we call as tolerance. Now, this drug becomes the thing in his life. So what started perhaps as an impulsive thing in the brain now becomes a compulsive use. And the brain has this ability that the more you use it, the stronger that network becomes. Right. So what started as an impulse and, for wanting to do cool or this one, now becomes a compulsive habit. Your brain has jumped into the fray. It is not letting go of the thing. So what started perhaps as temporary now becomes permanent changes in the brain. Right. Great. So, I mean, that actually explains the neurological basis of addiction, but why it can be so difficult to overcome now? Now, these are permanent brain changes now. So now you have to understand now addiction We no longer consider it as a voluntary activity, which is deliberately doing to get into it. Now we understand addiction as a chronic lifetime condition where the brain has changed. The drug has developed, is become salient. That is, it has become the most important thing in your life. Your
Right.
ability to, your reward system craves it because it needs a higher kick. It's permanently changed, if you remember.
Yeah.
Along with the change in the reward system, there is something called the cognitive network or the cognitive part of your brain, the thinking brain. What it does, it tells you this is right, this is wrong, do this time, don't do this time. That starts to weaken over time.
Mhm.
So the ability to take a proper judgment also reduces. So when the ability to take a proper judgment reduces, your need to keep using the drugs again and again increases. So what we are looking at are permanent brain changes. So there is a lot of difficulty. This person actually struggles very hard to control what the brain is dictating to him. So this is the reason why people find it so hard to get off the drug.
Great. I mean, you did touch upon it on the behavioral changes part of it, but I'll ask you, what are the common behavioral changes observed in individuals using substances, and how do these changes affect their daily lives and relationships, especially?
Yes. So if you look at behavioral changes per se, let's look at it externally and then we look at it internally. Externally, there will be a need to take the drug more and more because they're not able to get the same kick from the smaller amounts, or they crave the high that comes from a higher amount, or they're having withdrawal with a smaller amount. So they want to let go of the negative effect.
Sure.
They will, and in order to do that, their behavior will change to do anything to get the drug. Now, I have families where the husband is sold off not only the wife's gold, but even the utensils in the house just to feed his addiction because he's unable to stay off it. So, this is how the behavior changes. The father is no longer the father, he's only, he's in search of a substance. So, the time, that bonding that happens with the children and wife does not happen. The responsibilities he has to take as a husband or even as an employee, that starts to come down. So, life is all about procuring the drug, where should I get it, and where will I get my next one? And in even worse cases, some criminal activity also to obtain the drug. The absenteeism from work, like we discussed earlier, like not fulfilling either personal, social, or any kind of responsibilities that he may have, occupational responsibilities he may have.
Right.
Internally, what happens is there is a change in behavior that we just discussed. There will be change in emotion. So there's a lot of emotional lability. That is, there is anger, irritation, impulsive aggression. There's a lot of regret later.
Mm.
It cannot be controlled. Or judgments start happening. I told you cognitive, the network which is responsible for judgment, and the sane part of the brain it tells you, hey, look, this is not to be done. That part becomes also weakened over long-term substance use. So these are the part, that is the time this whole thing, he starts having poor judgments in many things in life. Okay. So gradually, decision making capacity, the ability to take proper judgments, to take the right decision at the right time, all these start to suffer, and consequently,
Mm.
perhaps all aspects of life get affected.
Absolutely, ma'am. Thank you so much. So we looked at neurological impact and behavioral changes in some detail. Let's look at the prevention strategies and preventive measures. So what are some effective preventive measures that have been implemented to curb drug abuse?
So prevention has to start at a very basic level of awareness first.
Mhm.
Many of us, like I'm from the state of Telangana, I already told you that Toddy is a culturally held practice. Now, while they were using, when it was culturally held, and in the older times, perhaps it was directly from the trees and directly tapped and then consumed. So therefore, the alcohol content was minimal. It was a part of all our growing up and also functions in marriages and deaths. So
Yeah.
now, with time, what has happened is it has started to get adulterated. So there are lots of benzodiazepines, that is, sleeping pills added to it, and God knows what else are being added. So as a result, what happens is a person who goes to consume toddy is actually consuming so many other things which he's not aware, and unfortunately, even us, the treating doctors, are not aware of what he's consuming.
Right.
So it starts from awareness. So
Mm.
also the other major important thing is peer pressure plays a very, very strong role in the first peg or the first path that you will have.
Yes.
So awareness in schools is also very, very important because children, when they come to us, I've had many children who come and tell me, so what, ma'am, everybody uses weed. I read it up and it says weed is a good painkiller, it's a euphoriant, it's legalized in many parts of the world. Having said all that, all
Mm.
of us are not similarly, reacting to that weed. Some may just have a puff and let it go. Some may directly jump into a serious medical illness called schizophrenia. So the reaction in each person, depending on genetics and other environmental factors, will make you what you are when you are reacting to the drug. So this kind of awareness is very essential. Awareness at school levels, because adolescence is a period when it starts. So we cannot, when you actually start the drug addiction, we are looking at perhaps the end of a long process of illness. So the intervention should start much earlier. So awareness that these drugs are very harmful is one. Awareness of who could be at risk is also a very important thing that we should consider.
Absolutely.
Who are at risk? Children who are genetically prone, father, mother consuming alcohol dependence with the maternal uncle, the paternal uncle, grandparents, the child has a high risk. Child having a lot of trauma in childhood, parents separated, neglect, abuse, physical, sexual, these are at high risk. Third, if these children themselves have temperaments which are, like say ADHD, they're not paying attention, they're impulsive, they're reactive to the so-called external, what we call in medical parlance as externalizing behaviors. These people are also more at risk. So this is necessary to pick out all these children. So not only do we need to bring awareness in society at large, parents in particular, and also the other big stakeholders, teachers, who can, pick up very quickly that these children are having. Now, this is at an individual level and community level. In addition to being aware that this is not good, it should not also be available, right? Especially for children. So therein the legislation steps in, and which we're already doing. That alcohol could not be served, that the tobacco should not, cigarettes cannot be sold to a certain age group. You have these big warning signs. So when you reduce the availability by reducing supply or by advertisement or by taxation, whichever by means, make it unreachable to this vulnerable age group. Increase awareness in them that when you do this, you're gambling away many years of your future for a few moments of pleasure.
Right.
And then possibly we would go to a long way in preventing. What happens, it's also been found, is that if we can postpone the drug use by a few years, so from adolescence to late adulthood, then also we have helped many children, because the brain matures till the age of mid-20s, say 25. Okay. So when you're looking at a less than 25-year-old person, his reward network, that is the one which says, oh, hey, let's go and get it, let's do this, let's do that, is far more active and impulsive than the network, the cognitive control network, which says, hey, don't do this, this is not good. So therefore, the adolescence is so full of turmoil and so full of turbulence, and they get attracted to the wrong things so quickly. So if we can postpone and allow the brain to mature and then give them access, perhaps it will be a little, safer. But easier said than done. But policies need to be in place, and some things are already being done.
Great, ma'am. Thank you so much. Can you share any successful case studies of these interventions, any programs from Telangana across the world?
Always, even the state of Telangana now has this thing of developing de-addiction centers in all government medical colleges. So we have a dedicated de-addiction ward, and our staff manages that. So in our patient profile, we have a lot of alcohol dependents coming. So they are admitted for a certain period of time. They are there. There is counseling done at that time. Family is taught how to support them through this processes of not punishing them for a relapse, of allowing them time to change, and we give them constant support on and help them with skills on how to control the triggers, how to keep maintaining the motivation, how frequently they should visit us, and of course government supply of medications, which is helping to control this addiction to a certain degree. Similarly, there are also opioid substitution centers which are being developed in the state capitals. Like in Gandhi Medical College, we have something called the OST Center. Now, this OST Center works for opioid treatment, substitution therapy, or harm reduction. So it works in any OST center across, it will work with collaboration with other NGOs. So they will pick out people from the community, refer here, and they are being treated here. So that is how we work in collaboration with the NGOs.
Great, ma'am. Thank you. I think you did mention a lot of the aspects when it comes to the role of education as such, but I'll ask you again, it is important, but how important is education, the prevention of drug abuse, and what age group should be targeted for educational programs, and what should these programs entail? To an extent, you did cover, but if you can give me a bit more.
Yes. Age groups to be covered are certainly the early adolescence. Because this is the time when the peer pressure, see, adolescence is a period where you are neither completely an adult, neither you are completely a child. This is the time that you start rebelling against your parents and say, I know everything. This is the time also when the friend makes more sense than the mother. So it is, and we cannot, and different children come from different backgrounds. So they all have influence on each other. That is how we grow up also. It is necessary. That is how we develop our social skills and all that.
Yeah.
But the flip side is when one child experiments with a drug and this child, supposing, is very popular in the class and everybody looks up to him like a hero figure,
Yeah.
there'll be a whole lot of the others who will be attracted to the same pathway. I'm not
Absolutely.
blaming the particular child, but every child who is attracted. It is the age. We don't blame them for that.
Yeah.
So who should be aware? It is the parents and as well as the children themselves and the teachers. So early adolescence is a good age to catch them, to make them understand. So if you have a curriculum on mental health hygiene per se in the textbooks, which talk of how to manage your stress,
Yes.
how to manage your social skills, how to manage peer pressure, how the art of saying a no, these all come very handy as life skills later in life when they are put under this pressure and made to feel the outsider because they're not going in with the trend. So this stands them in very good stead at that time. So it is very essential that children be taught these life skills. Teachers be taught how to teach these children. Teachers be taught how to pick out children at risk. And this education should also go to the parents, especially parenting skills are very important. Regular awareness on parenting skills and how not to pressure the child, how not to, inadvertently sometimes we abuse, we expose the child to a very toxic environment. Parents sometimes are totally clueless that something bad is happening to the child. So at the end, there is the seeds of an addiction or disorder or lifelong chronic disorder are laid in childhood. It is so some factors are we cannot change. For example, the genetics that you inherit, but we can change the environment, we can change the access, and even if it is accessible, we can change their awareness and educate them so that they will not reach out to this as a means of managing the stress or for a desire to fit in.
Great, ma'am. Thank you. Coming to the community part of it, in terms of community involvement, according to you, how can communities get involved in preventing drug abuse, and are there any specific community-based initiatives that have shown promise?
Community-based initiatives are being tried all over. Now, the government of India has also come up with many plans to involve communities to add. Majorly, it comes in education and awareness. Not only that, they also should play a major part in rehabilitation. You do not stigmatize. Now, see, our mental illnesses per se are very stigmatized. That somehow it becomes our fault to have the mental illness. Now, in the segment or in the sector of mental illnesses, it is the substance abuse which is far more stigmatized. Now, as a result of the stigma, the reaching out to the health services becomes very less. So that the treatment gap, that is the number of people needing treatment to number of people actually needing treatment, the figure has been put there somewhere between 75 to 90%, which means it's only about the 10 to 15 or 25% of people who actually need treatment are getting the treatment.
Yeah.
This is because of lack of awareness in the community as well. So it's very easy for a drug addicted or an addict to be pointed out and said he is responsible because he is taking the drug and he's putting it in his mouth. We didn't force it. But what we fail to understand is it is his underlying biology which is forcing him to take it time and time again.
Right.
So community needs to be involved. In total, there are a lot of programs being implemented under the Ministry of Social Justice and Empowerment. And in addition, the people, the stakeholders in the community, the leaders of the community need to be educated. So it could be the village panchayat, it could be the religious leaders in various religious institutions and the Purohit, the Maulvi who will guide properly, or it can simply, some countries usually have, they train with for mental health per se, they even train the other gatekeepers of mental health, what we call them, like the parlors. the beauty parlors is the place where the ladies talk the most.
Yeah.
So even when they are trained to sort of inculcate a kind of awareness. So you pick out who you think these people will go to, the school principal, the village head, the religious head, or any other influential members, educate them so that this education spreads into the rest of the community. It becomes far easier.
Thank you, ma'am. Now, you did touch upon the best practice with respect to rehabilitation. How about reintegration of these abuse victims back into the society now?
So reintegration means first, I think, reintegrating them back into the community. Many of them are ostracized. They don't want to be. People don't want them to be a part of the society. The friends move away. The wife separates. So the idea is to give them the support, allow them a second chance, and to get back into it. Treat it as a medical illness and approach it like a medical illness. Therefore, once the acceptance starts, that is one first point. Second is occupational reintegration also is very essential. Many of them, like we just discussed in the beginning, that it is farmers who stop going to work. But if he has his own farm, well and good, he can go back to it anytime. But it is the IT professionals who fall off the radar, cannot go back to work. Now, many of them are removed from jobs because they come to work drunk. No organization wants somebody who is drunk.
Yes.
So in that case, what happens is once they are under treatment and have gone through rehabilitation or medical treatment, it is the organization should step up and give them a chance to come back to work, guide them to work, give them adequate accommodations, what we call. Accommodate the effect of medications, allow them a little off time, give them a little leeway, but ensure that they are back to the job. That way, it goes a long way in supporting this need to not have the drug also, right? Once they realize that this is a chance that is coming to me, I will fight this harder. I will fight. I will be on medication. I'll be on the psychotherapy so that I'm not falling off the wagon. In fact, I have had people. I just got a text from my previous patient of mine who said, "I have been 10 years sober, and I thank you for all the support." Of course, it was a general thing he sent to all his friends and relatives also.
Yeah.
But he sent it to me, his treating doctor. He sent it to his friends, and he sent it to his relatives. Meaning, all of us were stakeholders in his journey to sobriety.
Great. Thank you, ma'am. So as a summary, what are the various medical and psychological consequences of drug abuse, ma'am?
So lots of consequences. What we see are, if what is visible totally is the accidents that take place under the influence of alcohol. You switch on the television and there it is. So the second is the thing that we are doing, like I told you, the effects on the community. Third is the thing that is happening to ourselves. Lots of damage happens when you put a drug of abuse into your system. No matter how it is touted to be, a euphoriant, or it is cool, or it is, it is a painkiller. No, anything which is not prescribed by your treating doctor and you're doing it yourself to feel good, it is considered, please consider it as a drug of abuse, especially because it can have psychological effects like depression, anxiety, and sometimes as severe as schizophrenia as well. Now, it can trigger in vulnerable individuals. When you take, say, alcohol over long term, your heart gets something called a dilated cardiomyopathy. So your heart is affected. Your stomach gets something called, starts with gastritis and then goes on to ulcers, and then you end up vomiting blood. Your liver goes through various stages of hepatitis and then finally ends in cirrhosis, which is a background for cancer. Your ability to secrete your testis will get atrophied because liver is not able to metabolize the hormones adequately. So when you look at the whole picture, you will find that the brain is suffering, the heart is suffering, the liver is suffering, the intestines are suffering, your reproductive organs are suffering. And if it is in a woman who is pregnant, the fetus also suffers from all the effects and born with a lot of defects. So all in all, there's not a single part of your body that is spared, body and mind that is spared when you're using a drug of abuse. So the consequences are terrible. You have to consider before you take the first puff, before your brain goes into the cycle of becoming vulnerable to more and more use of the drug.
Absolutely. Thank you. From a perspective of call to action for our listeners as such, how can we get involved in the fight against drug abuse and trafficking? And are there any resources or organizations you recommend they check out?
So let's come to the resources first. If you look at the website of Ministry of Social Empowerment and Justice, you will find a lot of resources there where you can get into. From a medical point of view, if you want to know more about, I will suggest you go to the videos generated by NIMHANS, which is the Apex Mental Health Institute in Bangalore. And they have a series of videos, educational videos, and also for professionals as well as the lay public, and very beautifully put on what is addiction and how you understand it. So these are two very good resources that you could go to. Their helplines also in the national websites. Please look them up, and you will find helpline numbers as well. Now, as individuals, what we need to do is first look at vulnerable people around us. Do not shun them. So as a result, we reduce the stigma. This opens up their ability to come and approach you when they have an issue, mental health, drug abuse, whatever. So accept them, educate yourself, be more aware, and find ways and means of helping them instead of being judgmental. So stigma is a thing which it's a huge barrier between a person having an illness like drug dependence and the treatment that is there. It stands like a mountain, and we are a part of it. So we start, the stigma starts ending with us.
Absolutely, ma'am. Thank you so much for lovely insights. I think it's going to be very, very useful for people right in the school levels, college levels, also professionals. I really hope this podcast goes viral. I'll put it on social media pretty shortly. I think we covered in terms of the themes, understanding the problem. You gave in-depth insights over there. We looked at brain and behavior. We looked at prevention strategies and support systems as such, ma'am. Thank you so much for your time today, Dr. Srilakshmi. And I think pretty shortly we'll come back to you with more, because I think you're not just defining the problem, but you're actually giving a lot of solutions which can be implemented in the society. So thanks a lot for your time, ma'am.
Thank you so much, sir. I wish you do continue with more such awareness activities. Thank you so much.